Hello, everyone, and welcome back to my YouTube channel. I am Quatemo Martinez. Again, three syllables, Quatemo, or you can say the C at the end, Quatemoc. And I'm here to talk about the mental health crisis in the Latin community. So, as you've seen all over the news, ICE raids are hitting every part of the country, and the mental health of our population is just getting worse with the fear mongering that is happening in today's society. And today I'm going to be talking about what is happening with the mental health resource. Is that we have in our population, who has access to those resources, what the data is saying about our mental health access, and what we can do about it, and what are next steps to confront these issues that are affecting our communities and populations today in 2025. And I do want to start with a disclaimer. Again, this content that I'm going to be sharing and talking live about, it's for educational and storytelling purposes only. I am not a licensed therapist or mental health professional. So if you're struggling with your mental health, please seek support from a qualified professional or contact a crisis line in your area. You deserve real help, real healing, and real support. You can find that information down in the description box below, as you watch this video in case you need it at any time. So let's begin. I myself am someone who had struggled or is struggling with mental health today. And I've also gone through a lot of mental health resources, mental health planning, mental health workshops, and uh, what would I call them? Programs that I don't know have fully cured. I don't think there's ever going to be a cure, but they have helped me manage my mental health a lot better, especially when national and global crises like this one happen in our communities. It's helped me be more clear on what we're going to be expecting and seeing from the society, and how to prepare mentally to build that resilience and to be the best support I can be for myself, for my family, and again, for my community. So, I did a little research project that I want to share with everyone. And I'm just going to be reading some statistics and doing it in a fun, playful manner. And I wanted to start this channel because what I've noticed is I come from the content marketing world. I've been helping public figures, content creators, brands grow their audiences, increase their revenues, and just increase engagement on social media platforms. And through that work, when I was working at these companies, I learned so much about technology, digital consumption, and just how we really digitized our lives, and the real world is becoming more and more empty. And honestly, it makes me sad because I used to be such a big extrovert, and I loved going outside. I loved going to the clubs, to parties, birthdays, dinners. And now I'm like hunching down and becoming more and more introverted, especially now with the ice raids. Like, I look Latino and carrying my little Virgen de Guadalupe on my necklace, just to remind me that, like, I'm being protected by someone. This was actually given to me by my father, my papa, and it's actual real gold. And the cute thing about it is that, like, you can't really tell. Well, maybe if I take this off, let me see. Again, I'm trying to make this as interactive as possible because it is YouTube. But if you look at it, it has like a Mexican flag. You see the red, yeah, and then it's green at the bottom. It's kind of hard to tell in this lighting. Oh, there we go. But you see those lines. So it's kind of gives the Mexican colors, which I love. He gave me this when I was a kid. Wherever you are, Dad. Thanks. I love it. It's so queer coded, low key. Because one, every Latino guy has like a Jesus cross. Not me. This FAG has Miss Lady Guadalupe on him. Okay, now it's really hard to put it back on. because my hands are already so clammy. But again, I'm going to be talking about what the Latino population is doing during these times with limited mental health care access. And then with the big, ugly bill that just passed in America, or that, well, essentially it did pass, and will be enacted in 2026. A lot of mental health care resources are even going to be harder to access because of Medicaid being taken away from these vulnerable communities, such as the Latino population, Latin population. So, going back to what I was saying, ADHD totally got sidetracked. But I worked as an audience development manager. So I just grew audiences, eyeballs, making sure that content was being seen for brands, public figures, and content creators. And through that career, I've learned how to develop an audience and how to reach different markets, digital markets across the internet. And I hope to apply that here on to my own channel. But something I noticed was that YouTube is a platform that heavily caters to the Latino population. So I'm going to pull out my handy dandy iPhone and we're going to do some research together. So when I look up a good platform research is Pew Research Center. I like looking up that content or the data analysis and charts from that website. It's the Pew Research Center. So I'm just going to look up Pew Research Center YouTube demographics. Let me put 2024 because I doubt they have the data from 2025. So here we go. So a large majority of teens also use YouTube with 90% reporting usage, yada, yada, yada. So 85% of US adults, teens. Okay, so this is by age. I want to do it by race. So let me fix my search. Once I have an editor, we're gonna have this like, me actually doing the live search, putting it on there, but I don't have time for that right now. So what I'm doing is I'm going live on YouTube and then just posting the video right after. So if you like talking and having a commenter in the background while you're doing your errands around the house, you're more than welcome. So to have this video in the background. So it's kind of more of a podcast, honestly, than it is a YouTube video. But until then, I'm going to be doing it this since video podcasting is a feature. And I keep forgetting to look at the camera versus at the screen. Okay. So Pew Research. Okay, so race, ethnicity, and YouTube. Black teens show a high rate of YouTube usage, with some reporting constant use. Hispanic teens also show high YouTube usage. So let me click on this. So this is for teens and adults. So let me put demographic by race and adults. So it'll be a little bit more clear. Okay. So let me just open this 5 facts about Americans and YouTube. Dun, dun, dun. Wow, it didn't show it. Okay. So back when I was doing my research, again, coming from the audience development world, what I noticed was that US Hispanics and Latinos consume YouTube at bigger, like 68% from the last time I remember reading the report. I'm trying to pull it up here. Race and ethnicity. And okay, here we go. Yeah, so YouTube is 89%, followed by Black community at 88%. Then we have white at the bottom with 82%. And then estimates for Asian adults are representative of English speakers only. So note white, Black, and Asian adults include those who report being only one race and are not Hispanic. Hispanics are of any race respondents. So Asians are at the top. Second is Hispanic, then Black, and then white. But then when I looked at, again, I'm looking at video consumption data and I'm seeing who is watching more of the popular videos on the YouTube section. I noticed that a lot of the population, I mean, 89% is still a big percentage. And when I scrolled on YouTube the other day, I noticed there was no real content around Latin mental health, especially with the crisis that's happening in today's world. And the only Latin mental health stories that were shared were from news segments. So if you do a quick Google search or YouTube search on your app on your laptop and you look up Latin mental health stories, Latin mental health programs, you're going to see a lot of non POC doctors talking about this is what we see in this is society. Or you're going to see news segments from like ABC, CBS, whatever, Fox Network. And it's just the stories of like the stigmas behind Latin mental health. So like we're still in the awareness phase of like mental health is becoming an issue in our populations. So I worked with a little research tool to come up with to look up at the mental health care access with the Latin population in the US, specifically with citizenship status and mental health service utilization. So, US citizens versus non citizens in Latin populations receiving care. So, recent studies show stark differences in mental health service use between US born Latinos and immigrants, non citizen Latinos. So, overall, US born Hispanics are more likely to have psychiatric disorders and to utilize services than immigrant Hispanics. So, people living in the US are more likely to have psychiatric disorders than those who immigrated here. And a lot of people always ask, like, well, how come us second gen, first generation born or not, sorry, our first and second generation Latinos have a rise in mental health versus those who immigrated here don't. So we'll get into that a little bit later, but a lot of it has to do with the environment, right? So like when you live in America, you're exposed to a lot more advertising and you're exposed to a lot of more consumerism versus immigrants who are coming here from a different country. They're less exposed to these commercialized environments and are more religious than the Americans living or the Latinos living in America. So those are some stark differences from what I've seen on why mental health is more apparent in American Latinos than they are with immigrant Latinos. And for example, one analysis of Mexican Americans found that foreign born Mexican immigrants use only about 40% as many mental health services as their US born counterparts. So, in fact, US born Mexican Americans were about 7 times more likely to access psychiatric treatment. 8.8% utilization than foreign born Mexican Americans, 1.2%. 8% is still a little bit. So if we go back to the population of Latinos in this country, if we go back to Laura Loomer, she's at careful with your language. Laura Loomer is this American politic commenter. I wouldn't even say analyst. But she was like, with the alligator Alcatraz that was just built, she was saying that these alligators have 65 million meals guaranteed. So basically saying they're going to feed every Latin person to these alligators, which is an insane statement to say. So if I take the 8.8% of the US population to that 65 million, I'm going to pull out my handy dandy calculator. But when I did a recent search, they say 1 in 4 Americans are Latino or Hispanic. So that means 25% of the population, which is actually 85 million, not 65 million. But for this case, in this Laura Loomy tweet that was tweeted a couple weeks ago, I'm going to use that as an example just to do it. So I'm going to put 65 million US citizens, and then I'm going to apply the 8.8% that are accessing psychiatric help. So when I do that, oh my God, it's going to be flipped. I just noticed. So, but this is saying 5.7 million people have accessed some sort of psychiatric help, me being one of them. And which may seem like a lot, but it's not that much. That's like a town, right? That could be like a little town here in California. So, and then they say that Mexicans or Latinos in general are less likely to want to access that care. So, we are, with all these ICE raids that are happening in our country today, and without us wanting to get care for access to mental health, we are in a very vulnerable and fearful position to even live our everyday lives. So we're not like the middle class America who just lost a lot of their jobs and are facing potential poverty for the first time, but a lot of Latinos have grown up in poverty, as I'll speak here, and we're resilient enough to overcome those issues. So we're just on mixing and layering more trauma on top of the already traumatized lives that some Latino populations have experienced. But going back, foreign born Mexican Americans, only 1.2% have access psychiatric treatment. And they're the ones who are being the most impacted from these ICE raids. So this indicates a huge gap between non-citizens in the Latinx community receiving mental health care as at much lower rates than regular citizens. So again, mentioning that about 79% of the Latino population in the US are citizens, including US born and naturalized, while 21% are non-citizens. The non-citizen group, which includes undocumented and other immigrants, is less engaged in formal mental health care. Fear of deportation and legal status often deter undocumented individuals from seeking help. Even among legal immigrants, lower acculturation, so that's like assimilating yourself to the culture, American culture, what they say, whitewashing yourself. So even among legal immigrants, lower acculturation and language barriers reduce service use. So, which makes sense, right? So a lot of immigrants wouldn't want to access mental health care because they believe, oh, the language barrier, or I'm not assimilated to American culture yet. So, they say therapy is for white people, or it's not what we do. We go to church, we are resilient. But sadly enough, it's not going to be helping us in the future, and we're just going to be attacked more and more by this administration in these next 4 years. So now let's look at service utilization rates. So national surveys consistently find Latinos underutilize mental health services. Only 35% of Hispanic Latinx adults with a diagnosed mental health illness receive treatment in a given year, compared to 46.2% of US adults overall. So 1 in 4 Americans identify or are Latino, and only 31% of adults of the Latin population with a diagnosis of mental illness receive treatment in a given year. So, out of the 85 million, not 65, remember, Laura Durham had her number wrong. Out of the 85 million Latinos that live in this country, only 35% of that get some sort of care in a given year. So this disparity is partly driven by the lower usage among immigrants, and US-born Latinos are more likely to obtain their care than foreign-born Latinos. So Latinx citizens access mental health care at higher rates than non-citizens who face additional barriers, which is a given, right? Latin-born or American-born citizens have more access to healthcare. So then when they get a job, their first full-time job or any type of job, they can get healthcare, and then they can sign up for whatever mental health services and resources that healthcare program provides at free, minimal, or at a high cost. So that is the difference between those Latin populations who are US citizens and then the population who are immigrants. So it's just taking comparison of who is actually utilizing the care. So I am someone who have used a lot of mental health resources from from the healthcare system, and I can talk about that later on in a different video, which I will talk about. But for now, I just want to talk about mental care health resources and accessibility within our community. So let's move on to the next point of accessing services and the barriers in the Latinx communities. So, regular access to mental health services. So, this is going to be talking about people who seek mental health resources outside of religion. I know if you're like my family, they always say like mental health is el diablo, right? Or like you feel this way because you haven't gone to church or mass. But a lot of Americans have stepped away from organized religion, especially those who are with higher education paths that attended schools that talked about organized religion and how it was used to control populations. But that's again another story. So this is just talking about regular mental health access for those who don't use religion as a source for mental health space. So, a relatively small share of the Latinx population has regular access to professional mental health services, therapists, counselors, psychiatrists, especially outside of faith based settings. So, many Latinos turn to organized religion or informal supports instead of medical professionals. One study found that 90% of immigrant Latinas endorse faith or church based support as a form of mental health care, far higher than those who are endorsed one on one counseling. So this is provided from unidosus.org. They are a national organization who has been helping the Latin population receive wealth, health, and care in our country since 2004. So if you ever want to find more information, go to unidosus.org. They're a great resource to find more information on how they're helping us elevate our lives in this country. Going back to the research, even among US born Latinas, about 65% saw faith based help as a resource, though individual counseling was the top choice for them. So even though a lot of them are like, still praying and going to church to get that extra counseling, they still prefer to seek a medical professional to actually know the root cause of what is happening and why they're being limited from their mental health. So, this highlights that while professional mental health services exist, many Latinos do not regularly engage with them, often relying on clergy, family, or community support. So, proportion with ongoing access. Precise numbers are hard to pin down, but indicators are low. According to the National Survey on Drug Use and Health in 2023, Hispanic adults were 60% less likely to have received any mental health treatment compared to white adults. And this is according to the Minority Health healthinitiative.gov website. And in practice, this means a much smaller fraction of Latinos have regular access to therapy or psychiatric care. When cultural and access barriers are addressed, providing cultural competent Spanish language services. So, like, very limited on Spanish language therapeutic services in this country in general. Latino utilization climbs to roughly equal the national average. So, only 8% of Latinos using mental health services in a year, similar to the 8.1 US average. So, US citizens and the Latino population engage with mental health access about the same rate. Because again, I feel like we're still in the awareness stage of everything. Like, oh, mental health. Oh, mental health. It's like being talked about a lot more ever since COVID happened. So that's really, really nice. And now it's even talked about even more in everyday life. So before it was talked about more, and I would say in like corporate spaces and like my higher education groups, but then now it's being more talked about in just regular populations and with the lay or what they say as the lay population and the common everyday individual. So what are some key barriers that access care? So several well-documented barriers contribute to low access. So cost and insurance. As we know, health insurance in this country is very, very diabolical, as they say. High costs and lack of insurance are major obstacles. Hispanics have the highest uninsured rate of any ethnicity. And now with the big ugly bill that just passed, that's going to be enacted in 2026, that Medicaid care is even more limited. So these numbers are going to be even smaller in the upcoming years. So as of 2019, about 20% of non-elderly Hispanics had no health insurance. Many Latino families live in poverty, 17% poverty rate, making mental health care often expensive and long term hard to afford. So, one analysis found poor Hispanics were half as likely as poor whites to access any specialty mental health care. So, overall, Hispanics were 50% less likely to be able to afford mental health care in the past year and 58% less likely to afford prescribed medications compared to whites. So, that's medications for like when you go to a psychiatrist and they give you like Zoloft or what was I on? Wellbutrin. God, hated that pill. So like they can't even get access to these n- SSRIs, which are, these antidepressant pills, which is unfortunate because, again, we are living in fear and have constant ads and rhetoric about being told that we're criminals and that we're not wanted in this country, even though we're literally helping sustain the health of this country in the farms and fields from the immigrant population. So financial barriers thus sharply limit regular treatment. And again, like especially a lot of Hispanics who are low income, who have to struggle and are being profiled and fined when they're detained or fined for doing little minuscule things that cops pull you over for. Like it just becomes expensive to not only be poor, but to be Latino. Take that for an account. Okay. So then there's the stigma. So again, el diablo, right? So the stigma and shame around illness remains powerful in Latinx culture. Many Latinos fear being labeled locos, crazy, if they seek help. So older generations in particular feel that acknowledging depression or anxiety reflects poorly on the family. This stigma leads to silence and avoidance of treatment. People may choose to suffer in silence or only confide in family slash clergy. Interestingly, surveys suggest Latinos might not always cite stigma overtly as a barrier, so perhaps due to normalization, but it is an underlying factor in low help seeking. Efforts to normalize mental health discussions in Latinx communities are ongoing to combat this. So everyone knows that there's the machismo-ness in the Latin culture. So it's just like, oh, just be a man. Like men don't cry. And it's very heavily taught to us at a very young age. And as someone who has identified as a very emotional person, I am a crier. I cry when I'm mad. I cry when I'm sad. I cry when I'm happy. I cry when I'm scared. I love to cry. Well, I don't love to cry, but like I cry. And I'm just a very emotionally sensitive person. So when my dad would be like telling me, well, when my dad was in my life, telling me to man up and to like stop being a girl, I was like, oh, what if I am a girl? Anyways, non-binary. Hello. Okay. So going on to the next barrier, language and cultural mismatch. So, language differences make accessing care challenging. Many Latino immigrants prefer Spanish, yet only a fraction of US mental health providers are Spanish proficient. Communication issues can lead to misdiagnosis or even frustration. One study found that Spanish speaking Hispanics were significantly less likely to even make a mental health visit than English speakers. Culturally, concepts of mental health illness may be expressed differently. Nervios for anxiety, right? A provider unfamiliar with Latino culture might misunderstand symptoms. So, lack of culturally competent care, few Latino clinicians or clinicians trained in Latino cultural values erodes trust. And that's the biggest thing about going to mental health resources and just finding a therapist or a psychiatrist is finding someone who understands you. When I started my journey in mental health, it was all white women. And it was fine because like they empathize, sympathize, but they don't understand where I'm coming from or why these things are happening. So again, I'll talk about that in a later video. Um, but a provider unfamiliar with Latino culture might misunderstand symptoms. As we said, Latino patients often feel providers don't get their background or family dynamics. Totally understand that. When I've seen like 7 different therapists in New York, San Francisco, LA, OC. And let me just say, it is rough out there. So, like, even if you do have access to the care, it's not even, it's like going, so like each therapist is like you have your Whole Foods, you have your Ralphs, and then you have the bodega in the corner, right? And, or let's say Walmart, because like who goes grocery shopping at Walmart? Latinos do because it's affordable. Anyways, um, but like again, like the different type of brands that are or food that is provided at these different grocery stores is gonna the quality is gonna be different. The taste is gonna be different. The price is gonna be different. So that's how I kind of felt going. So like even though like, oh my God, I'm gonna have a white woman therapist. She's gonna understand me emotionally. But then you're sitting there in your therapy session and you're like, this person doesn't get me at all. Like that's not why I was mad. That's not why I was sad, or that's not the reason what caused the tears, you know? And it was just a struggle. Um, and then that just builds a lot of distrust and fear because like this person doesn't get me. And then that's the other barrier is that, like, as noted, undocumented individuals often avoid all formal institutions out of fear and distrust. So the fear of deportation or legal consequences keeps many from seeking care at clinics or hospitals. So like even eligible family members might not enroll in Medicaid or public programs due to the mistrust, especially in today's world. So like even though we're advocating and bringing awareness like, oh, mental health this, mental health that, like you should get access to mental health care, ICE raids are happening. So even less people are going to sign up for mental health care because of the fear mongering that is happening from this administration. So, additionally, historical disparities and discrimination in healthcare contribute to a general distrust among some Latinos. They may question whether providers have their best interests at heart or worry about racism. And all these factors mean fewer Latino men and women establish a regular care routine with mental health professionals outside of church or home. So, in summary, relatively few Latinos, especially immigrant men, have consistent access to mental health services beyond their church or informal networks. Cost, the stigma, language, and even cultural distrust form a combination of barriers that limit use of therapy and psychiatric care in the Latinx population. So, efforts by organizations like Unidos US and others are ongoing to reduce these barriers and improve access. So, what do you do when we don't even want to access this care and we have ICE raids happening all around the country? So, we need to come together. And I always say, well, not me, but my therapist told me to do this. This is why I'm starting. This is probably the most boring video you've ever seen. And again, this is only my second video. I did my intro video and I'm doing this video, but I'm going to talk about this again. I am trying this out, and my when I did my trauma therapy, when I went on my mental health leave, my psychiatrist and my therapist said, you need to tell your story. So I am here just to bring more awareness, and I also want to bring solutions on how we can overcome these stupid barriers that are politicized to make us weaker, politicized to make us poorer, and politicized to make us hate one another, to be honest. So, one of the solutions for US citizens is to go take mental health leave. I am someone who has taken mental health leave, and I encourage, if your job offers mental health leave, or especially in California, I live in California, it's called FMLA, Family Medical Leave, and use it, abuse it, because you're being exploited every day. So you might as well take that resource. But in today's age, you might get laid off, like I did. And that's what sucks about today's age is that if you do take a leave, any kind of leave, you're easily on the chopping block because like, oh, he's weak. He's abusing resources. Abusing abusing resources. This is an available resource. So I'm gonna provide some sort of story or tell you the story about mental health leave access. Again, this only applies to anyone who can access that. For my non-citizens, again, there is a link in the description. I don't have a solution yet for what non-citizens or what immigrants can do besides going to church and finding support or finding a community that can help with free resources like any type of city-sponsored mental health resource fair in your local community. That can be a way to guarantee to get some sort of help. But again, with the fear of ICE raids, some people don't want to go. But I'm sure there's also Zoom links. I will do some research and see if I can find some help for the immigrant community. In the meantime, I'm going to be talking about how to access mental health leave. So, mental health leave from work in the Latinx community. So, taking mental health leave, prevalence, and paid disability. So, when you take a mental health leave, according to California law, when you're on FMLA, you can go on disability pay when you're on a medical leave. When you're on a medical leave. So, some companies are sponsored where they will pay you this disability pay and some won't. It's a very tedious process in itself, and already you're struggling with mental health, and now you have to do all this admin stuff to just even be guaranteed disability pay while you're on leave. Again, they never said this was a simple solution, but they make it complicated for a reason because they don't want to give you they don't want you to they don't want to pay for their damage to you, basically. They don't want to pay. They don't. So they make it as complicated as possible. But the data on mental health related work leave among Latinx employees, especially Latino men, are very limited. But available evidence suggests that relatively few take formal mental health leave and even fewer receive paid disability benefits for it. So, like I just said, even if you do go on FMLA in California, you're not going to be guaranteed those 12 weeks of pay. You might be on leave and like, okay, I got a mental break, but you're not getting paid. And we have bills, we have rent, we have families, we have ourselves to feed. So it's kind of a double-edged sword. It's like, okay, I need this mental health leave, but I need money. And it's this juggling dilemma of like, what do you do in this type of situations? So cultural and job related factors discourage many. So because of that, cultural and job related factors discourage many Latino workers from taking time off for mental health needs. So mental health leave in Latino men in general, US in the general US workforce, taking time off for mental health has become more common in recent years. Me, for example. One 2023 survey found that 63% of respondents had taken time off specifically for mental health reasons at some point, according to businessnewsdaily.com. Woo! So, again, as I mentioned earlier, ever since 2020, mental health was like mass market appeal. Like everyone's like, oh my God, companies are taking mental health seriously. They're providing more resources. So 63% have taken mental health leave. That's amazing. I love that. I love that. Me being one of them who took a mental health leave in 2022. So, however, a large portion did not feel safe labeling it as such. Nearly half lied about the reason, citing something else when taking the leave. So, in Latinx communities, the percentage taking mental health leave is likely lower than 63% due to heavier stigma and less access to paid leave. So, Latino men in particular may underutilize mental health days. Cultural norms of machismo and stoicism can pressure men to push through rather than admit to mental distress at work. Many fear negative judgments or jobs consequences if they take a mental health break. In surveys, a significant share of workers, especially remote workers, feared being seen as lazy for taking mental health days. And this concern can be acute for men of color. Precise figures by gender and ethnicity aren't readily available, but anecdotally, Latino men report rarely taking formal mental health leave unless problems become severe. Well, I always say take your mental health leave, but again, with companies just laying people off left and right for no freaking reason, even if I look at the layoff reports, a lot of people who were on maternity leave, people who were about to have baby were laid off. And then people who were on leave were laid off. Again, you're seen as lazy, even though you're just using a resource that is provided for you from day one. Do corporations not utilize and abuse any resource they can? And then here you are, an employee using a resource, and then they let go of you. It's ridiculous. Access to paid leave. So, one major reason for low uptake is that many Latino workers lack paid leave benefits. Fewer than half of Hispanic workers have paid sick days. Only about 47% have access, which is the lowest rate for any racial ethnic group. Luckily, in California, we just passed a law where farmer or those farmers that work in the fields are guaranteed some sort of sick paid days. Thank God. Actually, let me look. Let me look it up right now. Paid sick leave for immigrant farmers. So I look at news. Da, 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 da. So in California, agricultural workers, including immigrants, are entitled to paid sick leave thanks to the Senate Bill 1105. Bless, bless, bless. So employees, including those in agriculture, accrue at least 1 hour of paid sick leave for every 30 hours worked. Ah, would you look at that? Bless, bless, bless. We just passed that recently. Thank God. But now they're being rated at risk. So, like, how are you going to accumulate paid sick leave or paid sick days if you can't show up to work because you're potentially going to get raided, detained, and human trafficked? It's a lot. So going back, we are the lowest rate for any racial ethnic group to have any kind of paid sick days. Latino men have even lower access. Only 45% of Latino male workers had sick leave versus 51% of Latino female workers. So this means many cannot afford to take time off for mental health unless it's an absolute emergency. Even for longer term leave, most Latinos are not covered by paid family and medical leave. Again, what I mentioned, FMLA. Where was I? Okay, are not covered by paid family and medical leave. Nearly 75% of Latinos have zero paid family leave coverage. And we're the ones who are having, well, not me, but the Latino population is having the most babies in this country. So from 2020 to 2024, Hispanic and Asian women saw increases in births, while Black and white women experienced declines. Especially Hispanic women birth rates rose by 4%, and then Asian women raised by 5%, whereas births decreased for Black women 4%, and American Indian and Alaskan Native women decreased by 3%, and then less than 1% for white women. So here we are having the most babies in this country, yet we don't have paid family leave. And then if you do have a baby and go on maternity leave or paternity leave, guess what? You are potentially going to get laid off if your CEO had a bad quarter and his stock plummets. The T. 75% of Latinos have zero paid family leave coverage. 75% going back to the 85, 65 million Hispanic Latinos in this country. 75. They love to exploit us. This is modern day slavery. Like, hiking. In a 2017 Pew survey, so Pew Research Center, about 23% of Latino workers said they needed to take family or medical leave in the past 2 years for any serious health or family reason, but many could not take it or took it unpaid. We can infer that only a subset of that 23% was for mental health, since that includes all illnesses. Thus, the proportion of Latino community members actually taking mental health leave, especially a prolonged leave, in a given year is likely in the single digits percentage. They're taking away Medicaid and SNAP. So they're taking away our mental health and then our physical health even more. So it's already bad. It's about to be worse. I just had some nervios. Oh my God. Okay. So paid disability leave for mental health. On those Latinos who do take mental health related leave from work, only a small fraction receive paid disability benefits. Most either use regular sick days / PTO to take unpaid leave. Mental health conditions are underrepresented among formal disability claims nationally. For instance, in 2020, Behavioral health conditions, mental health disorders, stress, substance abuse accounted for just 6% of short term disability claims in a major US employee insurance pool. So they ranked fifth among leading causes of disability leaves. This low percentage suggests that relatively few workers who need time off for mental health and end up on officially disability leave. The situation for Latino workers is likely similar or even more skewed because they have lower access to disability insurance through employers. Many Latino men work in industries or jobs that lack comprehensive disability coverage, or they might avoid filing a disability claim due to the stigma or job insecurity. In summary, the majority of Latinx individuals who take mental health leave do not receive paid disability. They either take sick leave if available or forego income. Those who do get paid leave usually tap state or an employer's short term disability plans, but since Latinos have lower access to such benefits, this is a rare outcome. So, in my next video, I'm going to be talking about my journey through the mental health leave journey. Honestly, it's thank you, Virgencita. Even though I'm not religious, I'm still spiritual. I grew up Catholic, and I do take account the privilege and the access that I had to mental health care, especially a mental health leave through the employer that basically sponsored that, which they should, because the reason I have these mental health problems are because of the systemic environments we were born in. But it's sad to know that it's very low access and a rare outcome for our people to have access to this kind of life-saving care. And now with the big ugly bill that just passed and hopefully won't be pushed if we get to flip the House and Senate, it's gonna be harder. Like, I don't think people understand how much harder it's going to be Latino. I just don't think they understand. Comparison to overall US population. In the overall US workforce, mental health leave is becoming more recognized, but still only a minority of all disability leaves. As noted, about 6% of all short term disability claims were for mental health in 2022. That figure gives a rough baseline for paid disability leave for mental health nationally. It implies that out of all workers taking any disability leave, only 1 in 20 did so for a mental health condition. For the Latinx population, we don't have a separate statistic, but it's likely in the same range or lower. If fewer Latinos take mental health leave to begin with, then fewer will be represented in paid leave statistics. The overall awareness is growing, though a majority of all workers, including Latinx, say workplace mental health support is important, and younger employees are pushing for acceptance of mental health days. Still, the gap is large. While a majority of Americans report having taken a mental health day off, so a lot of companies, if you work full time at a white collar job, they now have like mental health days, which is really, really nice. But the formalization of paid mental health leave disability remains very low, both overall and in the Latinx community. So, the bottom line, taking mental health leave from work is still relatively uncommon in the Latinx community, especially among Latino men. Estimates suggest only a modest percentage have ever taken time off for mental well being, and cultural stigma leads many to hide the true reasons. Because Latinos face disparities in paid leave benefits, with less than half having paid sick leave, most who do need time off for mental health do not get paid disability coverage. In comparison to the US population at large, where mental health leave is becoming more mainstream, but only 6% of disability claims, Latino workers likely take even fewer paid mental health leaves. Improving access to paid leave and reducing stigma in the workplace can help reduce this gap. Wow. So, what did we learn? We learned that obviously US born Latinos have greater access to mental health care services compared to immigrants and non-citizens, Latino populations in this country, because of those cultural differences, the language barriers that we have to overcome to even want to participate and get help. And then we also learned about the access to care, right? So literally, oh my God, I was just talking about that. So the limited access to care because a lot of Latinos don't even have the jobs that give them paid sick days or paid sick leave. And to even qualify for disability pay is crazy. And then those who do end up having some fancy job, who work in tech or who work for government jobs, and they're able to take these leaves. A lot of them don't want to take the leave because, again, oh, like, aren't Mexicans and Latino or Latinos supposed to be resilient? Aren't Latinos supposed to be pushing through things? It's very frustrating. So, in my next video, I'm going to be talking about how you can access mental health leave through the FMLA Act for Californians. I will try to explore other cities, other states as well. So, I'm going to be talking about how and why you should do it. I think someone who has done mental health leave, it's I've went a little loco, I'm not going to lie. But also it's actually helped my family get through times like these under this administration when facing scary policies that affect our everyday life. And, you know, I try to keep my head high and keep a beacon of hope that people that want to share their stories can help others realize that I wanna break the stigma. I am not some macho man, but I am a Latino person who has gone through a mental health leave, and I will be sharing that story again in another video. So hit that like and subscribe button. Let me know in the comments what you think I should be talking about more or you're curious about. And again, if you do need any type of medical attention, I really encourage you find support in the description below. Use one of the resources provided because the only way we're going to get through these next who knows how many years this dictatorship is going to last is by helping each other and by using our voices and helping everyone. So in the meantime, I'll see you next time, and thanks for tuning in.